I'm delighted to rise to make a contribution on the Victorian Collaborative Centre for Mental Health and Wellbeing Bill 2021. This bill tackles one of the most significant and landmark reforms in Victoria's history. Mental health issue is challenging for the community and the government. It is an issue that transcends borders. Every state, national or international border has to tackle it. There are so many people whose lives were cut shorter due to their struggles with mental health. Mental health issues can impact anyone, be it a school student, a young adult, a middle-aged or old-aged person. We all probably know someone who is struggling with their mental health. That's why we are making sure that we take a proactive approach. Victoria has become one of the most progressive states in Australia when it comes to making mental health a priority. The pandemic has shown to us how important mental health is. We can't take it for granted. As I grow older, I realize even more how important a healthy life is. It has been about 260 days since the Royal Commission final report was released. It was a historic joint sitting of the Parliament. The Andrews Labor government has proven that mental health of Victorians is a major priority for us. We proved it by providing the single largest investment into mental health in Australia's history. The $3.8 billion commitment will build a new mental health system from ground up, a system which supports mental well-being and health of Victorians, a system where Victorians can seek help without any judgment. This is why we have shown commitment towards implementing all recommendations. We have been committed to it since the day we established the Royal Commission, and we are delivering on them. We are getting on with implementing these monumental reforms. Today, I'm so proud to be contributing to this bill. This legislation will enshrine the Victorian Collaborative Centre for Mental Health and Wellbeing. This bill is vital because it gives us an approach to tackle and deal with these issues directly in a considered and thoughtful manner. This Melbourne-based purpose-built facility will be conducting research, training, and providing a full suite of mental health services to adults and older adults. The objectives of the Collaborative Centre are transparent. It will exhibit Victoria's transformed mental health and well-being system, the characteristics of responsiveness, collaboration, and continuous improvement will be actualized by the centre. It will draw upon the expertise and experiences from across Victoria and internationally to research, develop, and distribute effective practice to effect large-scale positive changes across the system. The centre will integrate the participation of people with lived experience across all functions and governance levels. The proximity of cutting-edge research with innovative service provision within the Collaborative Centre will ensure research priorities are set by mental health consumers, carers, and practitioners, and ensure new knowledge is relevant to and translated into practice. In delivering on these objectives, the Collaborative Centre will be held to many guiding principles which were highlighted by Dr. Q in his contribution today. There are 8 functions of the Collaborative Centre. Firstly, the centre aims to provide, promote, and coordinate the provision of mental health and wellbeing services. This will include providing a comprehensive range of multidisciplinary services to adults and older adults in their local community. Secondly, this centre will also provide or arrange the provision of specialist support services and care for persons who have experienced trauma. This provides for the establishment of the statewide trauma service, which will improve mental health and well-being outcomes for people of all ages with lived experience of trauma. Thirdly, the centre will also conduct, promote, and coordinate interdisciplinary translational mental health and well-being research, including developing and implementing a broad research strategy, disseminating knowledge through a formal statewide network, and delivering a clearinghouse for research output and best practice guidance. Additionally, the Collaborative Centre will establish links and service access pathways between mental health services and the centre by performing a coordination function for statewide services and supporting service improvement. The center will provide, promote, and coordinate activities that support the continuing education and professional development of service providers and persons who work or conduct research in the field of mental health and well-being. It will also develop and implement research strategies that addresses priority needs in Victoria's mental health and well-being system, including through collaboration with the mental health and well-being sector, workforce development organizations, and academic and research institutes and entities. The Collaborative Center will collate and disseminate best practice advice and guidance to be applied across mental health and well-being settings. Finally, it will report to the Minister and Secretary on its functions. These functions will help to complement wider reforms in the mental health space. It will also support the Andrews Labor government's commitment to implementing the recommendations of the Royal Commission in full. It is important to have a robust governance structure. The critical feature of the center is its leadership. This bill will make sure that people with lived experience of mental illness or psychological distress are represented at every level of the Collaborative Center, including on its governance board. This is part of an innovative co-director model of executive leadership and throughout senior management. By forging ahead with standalone legislation for the Collaborative Center, we can get started as soon as possible on priority actions to establish this landmark entity, including the appointment of a board by March 2022, commencement of capital planning by early 2024, and a bricks and mortar site expected to be up and running by late 2026. The governance board has 4 dedicated positions for people with lived experience, 2 with a consumer background, and 2 with a family, carer, or supporter background. These positions aim to reflect some of the diversity that exists across people with the lived experience of mental illness or psychological distress and promote their active and full participation at all levels of the mental health and well-being sector. The bill provides for the board to establish 2 key partnerships, one with a health service and one with a research partner. Once both partners are selected, they will have dedicated positions on the Collaborative Center's board. This will help with creating greater integration between research and service delivery. It will also nurture and establish a wide range of partnerships across academic and health sectors. This is very crucial for the Collaborative Center to fulfill its functions at the center of a networked and adaptive mental health and well-being system. The center will also feature an innovative joint executive leadership model with co-directors working collaboratively to facilitate the center's operations. One of the co-directors will be a person with the lived experience of mental illness, and the other director will come from an academic background. The co-directors will have joint executive authority over the operations and strategy of the Collaborative Center, similar to the more traditional role of a chief executive officer in a single executive leadership arrangement. This approach is intended to foster cooperation and will ensure that traditional power structures identified by the Royal Commission that placed greater emphasis on clinical academic expertise are adjusted to incorporate greater agency for people with lived experience. In establishing these governance arrangements, this bill aims to hold fast to the centrality of the experience and outcomes for people with lived experience. That means their voices and perspectives must be part of any solutions within the system. This board will oversee not just the center's functions, but the vision of the Royal Commission for Innovation and Transformation, and importantly, genuine lived experience leadership to steer our mental health and well-being system into the future. As I mentioned earlier, the 2021-22 Victorian State Budget has committed a record $3.8 billion to create a new mental health and well-being system based directly on the recommendation of the Royal Commission into Victoria's mental health system. Our commitment to mental health and well-being ensures that people can access appropriate care and support where they need it and close to home. In the most recent budget, we provided $842 million to rebuild mental health and well-being supports for children and young people under the plan set out by the Royal Commission final report. The Andrews Labor government continues to continues to closely monitor the impact of the coronavirus pandemic on the mental health of Victorians. We know how tough the last 20 months have been for the community and recognize that the mental health effects could long outlast the pandemic itself. To ensure Victorians get the care they need during and well beyond the pandemic, more than $247 million in additional funding has been provided to support our mental health services. In conclusion, Acting President, the Andrews Labour government is committed to Victorians' mental health and well-being, and we are delivering on it. We want Victoria to become the best place to develop and disseminate mental health research, and this center is the key part of that agenda. I commend this bill to the House.